the next treatment technique we'll cover is lateral costal breathing. There's a variety of methods, a variety of conditions you can use this technique for, and kind of different approaches to addressing what you see in front of you. This can be used as a facilitatory technique to breathe a little bit more into a segment, or a splinting technique to produce a little bit of pain. So depending on what you see in front of you, you can use it in a different variety. Okay? So the basic idea is that the placement of your hands provides appropriate receptive input to the body to stimulate increased chest wall expansion. Right? Similar to what you would do, with rehabilitating a patient using PNF techniques, that tactile input can cause greater motor output. Okay? So can you speak forward for me just a little bit, John? Thank you. Okay? So it doesn't always have to be even just on the lateral costal segments for what you're doing. We'll demonstrate it here for the purposes of this examination. Okay? So here, again, you can kind of, depending on your anatomy in your hands, you can do a cross, flat hand, or the V. I'm going to use kind of a flat hand approach, right? So what I want you to do here, Josh, is breathe normally. So what you're really going to be doing is first is just assessing kind of how they breathe normally. I'm looking for any asymmetries, just grossly. And what you can have them do, you can apply a slight down pressure, breathe into my hands, and breathe out. Breathe in, and breathe out. Now say if there was an asymmetry, you could even do it with one hand. Say one side doesn't move very well, we'll do this side. So you guys can see or visualize a little better. Placing my flat hand here, breathe into this segment, and breathe out. Now say if there was, his chest wall excursion, of course, is pretty normal. But say there was a patient maybe with, atelectasis or some kind of chest wall, hypomobility. Placing that tactile input may allow them to breathe a little bit more, kind of feet forward, right? Someone with a rib fracture or pain in their thorax, you can also apply a splint or a kind of a constant pressure to help reduce a little bit of pain. The natural reflex of the body when we have injuries that kind of guard down again to reduce motion. This does that in a certain sense as well. So if someone has a bruised rib or rib fracture, providing a little bit of extra stability may help reduce pain. And if we can reduce pain, we can improve expansion into those segments. So it's pretty important. So say we'll kind of go in that same region. Say Josh here has a little bit of a fracture here in his ribs. You can apply a little bit of a support. Just have him breathe. It may help reduce his pain to allow him to take a normal excursion. You can also teach him to place his hand here and to splint for himself to allow him to kind of do it independently. Or use a pillow. Same idea. Kind of have it race down. Good. So that's lateral costal breathing. Some of the techniques you can use depending on what you see for your patients.